Good evening to each of you.
Good
Welcome.
evening.
We're glad you're here. We could wish there were a few more here to see this presentation by Dr. Henley, but I'm glad that you've come. And I'm Dr. Hal Harden, and our main speaker tonight is Dr. Jackson Henley, who's a Loma Linda University graduate from the School of Medicine in 2011, and then he completed an emergency room residency at Wake Forest University in Winston-Salem, North Carolina from 2011 to 2014, and he moved to our valley in August of 2014, and we're glad that he's here in the area. He lives in the Kashmir area generally, and works for Confluence Health here in the valley, I think mostly, but you occasionally go to Moses Lake, is that correct?
Occasionally, yeah.
Yeah.
About 20% of the time. So.
I see. Okay, and Dr. Henley is going to give us a presentation on infectious disease, and his area is a broad one that I've assigned to him and that he agreed to cover, and that includes lung and gastrointestinal diseases, including liver disease, and maybe you might mention the kidneys too. So,
maybe I'll throw them in there last minute.
Yeah, that's right, okay. Thank you. There are restrooms down at the end of the hall if any of you need to use the facilities. Thank you, and Dr. Henley, you're on.
Thanks. All right, thank you, Dr. Harden. And yeah, I'm Jackson Henley. It's nice to be here. Thanks for having me. Just so I know my audience a bit, raise your hand if you have any medical background at all. Okay, all right. It doesn't matter because I've made this for anybody. But if no one would be opposed, I'd like to just open with a quick word of prayer, if that would be okay.
Sure.
Dear Lord, thank you for this opportunity to be here. Thank you for the knowledge that we have been given through not only modern medicine and technology, but also Scripture. We always have to acknowledge that you're the master physician and the master scientist, and you know the beginning from the end. And thank you again for this opportunity. I pray that you will speak through me and that we can all learn a little bit of something tonight. In your name, amen. So, so Dr. Harden approached me about this and asked me to just give a quick little chat on infectious disease, lung, GI, and liver systems. So you could probably spend, several years in writing a dissertation on each of these topics, of course. So it'll be kind of touching the surface on a lot of things, but I did my best to kind of just hit a few interesting points and make it kind of interesting. Along the way, if anyone has any questions at all, then feel free to interrupt me. I'm not even sure if I'm going to go over or under. It just kind of depends on how much I talk and how many questions there are. So we'll see how it goes. Again, just the highlights, right? How many infectious diseases could there be? If you just Google infectious diseases, then you'll get a quick comprehensive list of about 250 diseases, and I'm sure there are many more than that that we may or may not know about. I won't be hitting all of these, of course. I just don't have the time, or the energy, or the knowledge. A lot of these some of these I haven't even heard of before. Of course, all of this, and we all know this, but this all comes down to prevention. This is one of the biggest things that we can control, and it is by far the best medicine. I work in the emergency. I do a little bit of urgent care, but I also work primarily in the emergency room, 95% of the time. And it's amazing the amount of easily preventable things that I take care of, and sometimes it's a lack of knowledge, sometimes it's a lack of self-control, and a lot of times it's kind of a mixture of both of those things. But we also live in a world ridden with germs, and there's no getting around that. So, of course, simple things like hand washing and just basic hygiene are very important. Staying healthy, promoting a good circulation, and then avoiding harmful substances and unhealthy habits. So, the basic big ones would be tobacco, alcohol, and of course hard drugs as well. I was actually at I had to do a suicide prevention course today for about 8 hours. It was just mandated for all healthcare providers. And one of the most interesting parts that I saw was she had a picture of scans of normal brains and compared them with brains of methamphetamine users. And it was like Swiss cheese. It's amazing what these hard drugs can do to your brain. You may look fine, probably not, but you may look fine on the surface, but it's just amazing the kind of damage it does internally. And then drinking clean water. These things we really take for granted in this country. You would be amazed. I've done a little bit of travel here and there and some medical mission work in Uganda and Peru primarily. And just clean water. I mean, it's amazing that we are as blessed as we are to live in a country where we just don't have to think twice about drinking out of the tap. Whereas in such a huge portion of the world and the amount of population affected, they just don't have clean water, and because of that, it just affects so many different aspects of health. This one? Prevention. So just some biblical advice. So in Leviticus 15:11, it says, "And whomever the one who has the discharge touches," I think they're talking about discharge from a skin wound, "and has not rinsed his hands in water, he shall wash his clothes and bathe in water, and be unclean until evening." This is how many thousands of years ago do you think? 3,000 years ago maybe? Proverbs 5:15, "Drink water from your own cistern, flowing water from your own well." So there was some sort of a connection that they had even back then between clean water and health. And so fast forward to 1847, about 2,500 years later or so, there was an Austrian doctor who finally actually made a connection between, there were, I believe, medical students or apprentices or something who were going from doing autopsies and cadavers to delivering babies. No hand washing, no gloves. And at that point, there was about a 15 to 20% chance that these mothers birthing their children would come down with, I forget the name that they referred to it then, but it would be some sort of infection. He decided to, okay, well, let's take a group of people and have them just wash their hands. And it cut it down from about 17% down to 3% pretty much overnight. It still took decades more to actually implement that because no one believed him, unfortunately. And it's amazing to think how many thousands of lives were lost just because of one basic thing like that. And then Louis Pasteur discovered what we now refer to as germs and bacteria and microbes in the 1860s. So when we're talking about infections, we have several different types, just kind of broad categories. We've got bacteria, viral infections, fungal, parasitic, protozoan, and then prion disease. Prion disease, there isn't really a good picture of it because it's really just kind of a chemical makeup of an abnormally shaped protein. It's actually kind of interesting, and the knowledge that we have about it this day and age is still somewhat limited. So infection can cause such a broad range of symptoms and how that's manifested. So these all look kind of similar, but they're caused by extremely different things. Can anyone take a guess at what the one in the top left corner is? Ringworm. Yeah, that's exactly right. So that would be a fungal infection. And then what about this one right here that looks kind of like a bullseye? Any guesses?
Infection generally.
Yeah. So this
like
is
boil.
It does look like a boil, and it can mimic a lot of things. But with that classic bullseye appearance, that's actually from a tick bite. That's Lyme disease. So if that goes untreated, it can be pretty bad. It can end up causing heart problems and even death. But that's one of the first things that you'll see. Fortunately, we don't have that around here. It's named after a place called Lyme, Connecticut, Lyme. So it's most prevalent up in the New England area, but more so on the East Coast. And then what about this one? And it's kind of hard to see based off that picture. I don't expect anyone to know, but does anyone want to take a guess?
Psoriasis rosacea.
That's a good guess. It looks like it does look like that. So this is actually a picture of a shingles rash. You could probably, I couldn't find a good picture of, I just treated a gentleman yesterday who came in with chest pain and was worried about he's having a heart attack. And you lift up his gown and he's got blisters all across the side of his chest there. He had shingles.
Little blisters probably.
Yeah, and it's classically the one way to distinguish it from certain other rashes and infections, other than its blister appearance, is it's always just on one side of the body. It does not cross the midline. It wraps around you kind of like a C. So it will not cross to the other side of your chest, and it won't cross to the other side of your spine. It's just going to stay on one side. If it crosses the midline, then it's not shingles. And so we have other interesting things that fortunately we don't see in the United States.
Leprosy?
Yes, exactly. And so the red is where we still do see it. Leprosy has been, there still may be a few cases here and there, and I know there was a colony in Louisiana in a rehab center where Dr. Paul Brand worked out of. I don't know if any of you have heard of him. He's a very renowned orthopedic surgeon who ended up doing a lot of study and research into leprosy, and wrote a book called Fearfully and Wonderfully Made, a Christian gentleman. I recommend that to anyone. It's an amazing book. And that actually kills the nerve endings, and so you can't feel pain. He refers to it as the gift of pain. You don't really think of pain as being a gift, but people, especially in third world countries who are still using candlelight frequently, will reach and burn the end of their finger and not even realize it. And after you do that about 100 times, it does chronic deformities, and I mean, this is having the disease for decades. And then it can also cause these lepromas in the face, which are these really deep wrinkles and chronic deformities. And that's caused by a bacteria, and it's not particularly hard to treat. You just have to identify it and put some on antibiotics for a long time. So I couldn't not talk about the flu. It's probably not the most exciting or exotic thing to talk about, but we're just now getting some cases. We're just starting flu season. It's one of our, that's the virus that you think about it. If someone asked me to name a virus, that's the first one that would come to mind probably. So the actual flu is caused by the influenza virus. Now this is different than what people would refer to as the stomach flu, which is actually a misnomer. The stomach flu is not caused by the flu. It's usually caused by a rotavirus or norovirus or sometimes a bacteria, which is more vomiting and diarrhea or sometimes food poisoning. So influenza, I found a nice picture. It's partly cut off there, but that just says joint aches down there. So some of the most pronounced symptoms with influenza are going to be muscle aches, joint aches, headache, high fevers, rigors, the shakes, sweats, those types of things, along with some respiratory symptoms. It's definitely, it really differentiates itself from a common cold because of that. I've, knock on wood, I haven't had it yet, because when you have it, you know it. It really just knocks you down for usually a solid 5 days or so. Requires a lot of bed rest and fluids. So it's spread by respiratory droplets. It's actually contagious for 1 day before you even develop symptoms, which is why, again, I can't reemphasize enough the importance of hand washing, especially during flu season, because this is a very contagious thing. And so, yes, frequent hand washing, flu vaccine for those, well, the CDC actually recommends it for everybody over the age of 6 months, but especially for those at high risk, meaning people with other medical problems like asthma, lung disease, diabetes, things of that nature. And then this isn't something that you necessarily need a specific treatment for other than time, because the vast majority of people do get better from it with really nothing at all other than hydration and time. That being said, I don't want to downplay this illness, because I've taken care of all too many people who have actually become very ill from this. I took care of a gal who was in her early 30s who ended up dying from it. And for whatever reason, it just affects different people differently. There was a strain a couple of years ago that they were just seeing a lot of younger, healthy people getting really, really ill, and a lot of deaths, and they just didn't know why. But typically, it seems to affect the very extremes of age, very young, very old. And so, if there's confusion, difficulty breathing, you start to get better, but then you get worse, that could be a sign of a secondary bacterial infection. Those will all be reasons to seek medical advice. In some cases, as soon as possible, if one is actually legitimately short of breath from something like this. But again, the take-home point is most people do just fine. I have another slide. Yeah, so I'll just talk about this real quick. And most of my slides aren't quite this busy, but so just a quick thing about the vaccine. So it's a yearly injection. Unfortunately, it's not good for life because there's so much change between the actual. It's still the influenza virus, but it changes the type of antigens on the surface of that virus that the body can recognize. And so we don't become immune for life from it ever. So if you look up what the CDC says, it says usually about 50 to 60% effective at completely preventing it. If you get it and you're exposed to it at least 2 weeks after you get it, because it takes a few weeks for your body to actually recognize it and for it to work, then it's fairly effective. Definitely not 100%. Last year, 23%. It was a really poor match. They do their best just based on testing. I don't really know the details, to be honest. That's something that is left up to the public health folks and CDC. Even if you get the flu, it actually has been shown to decrease the amount of people who end up in the ICU if you compare people who are vaccinated versus those who are not. Oh, and then just a word about it. I hear this all the time, but the flu vaccine does not cause the flu. Most of the time, especially if you get the injection, it's from broken up parts of the virus. There is not a single live virus in there. If you get the one that's inhaled by nasally, then that is an inactivated form, but a whole virus. You still can't get it from that because they're very weakened. They're not offering that this year anyway, just for reasons of the antigen type. And then lastly, there are about 1 to 2 cases of something called Guillain-Barré syndrome per million of vaccines. So that can be a very dangerous thing. It's a type of paralysis that affects the nerves. And it's thought to be an autoimmune type thing where the body gets confused and starts attacking its own nerves. So, but again,
I have a question.
Yes.
While you're on that topic, I got deathly ill with an influenza virus like a few years ago, and it lasted almost a whole month. I thought I was going to die, really.
Wow.
But it started in my neck, and would that be the central nervous system, where it started in my neck, and I felt like I couldn't even move my head, and then it moved into my then it moved into my respiratory, then it moved into my stomach, then it went to my sinuses. It was like just it kept attacking different parts of my body. And I hadn't had a flu shot that year, and ever since then I've gotten one because I never wanted that again. But
the flu usually lasts about, I would say 10 days max.
It was 1 to 2 weeks where it was so severe, and I couldn't even. I was out away from telephone service, or I was out in the sticks, and I couldn't even get help. But so it was very traumatic. But then about the second week, it started kind of getting on the. I couldn't even eat anything for more than a week, and it was probably that. That right there.
It certainly sounds possible. I mean, I don't know many people who have dealt with that for a month. I mean, when you're talking that kind of time frame, that sounds maybe a bit more like. I mean, if it's more cold and sore throat and some other stuff, then mono can cause a more long-lasting illness like that. If you had neck pain and stiffness, then that you could have had even a viral meningitis.
Right. Finally, I was able to contact my father when it went into my face. I was worried about it attacking my brain next.
Yeah.
Maybe it did. I don't know. But let's leave that out.
But it sounds like you recovered. Okay. It just took a long time.
Yes, but he finally did prescribe antibiotics for the sinusitis or whatever the facial thing was, and I snapped. I turned it around in just a day or two as soon as I started taking the antibiotics. Yeah,
and that is a thing. And it's always possible that it could have started as influenza or some sort of a viral illness and then turned into bacterial because your immune system takes a hit from that. And then again, we take care of people who develop a really bad pneumonia, which it gets confusing because influenza can cause pneumonia, but it can also put you at risk for bacterial pneumonia, and there are different treatments. So if you're really, really sick, then in flu season, we pretty much just throw the kitchen sink at you and do lots of antibiotics and antiviral medication. Yes?
Just curious, because a lot of people are saying that many people die from flu shots. Because it's on Facebook, and we hear friends saying that they don't want their kids getting this vaccine because like for example, there was a little girl about 6 years old. She was very bubbly. She was very healthy, and then she got the flu shot, and then she died after that.
Wow.
So I don't really know why there's a lot of things going on, negative things going on regarding the flu shots.
Well, it's I'm glad you brought that up because there is it's for some reason it is one of, if not the most controversial thing out there. If you just Google flu vaccine, the first thing that will come up will be like the CDC, and some of the official stuff. And then a few websites down, it's going to be, the truth about vaccines and stuff like that.
Yeah.
And there's a lot of negative stuff out there about them. And, I guess just to give you a shorter answer, I don't think anyone knows if someone tells you with 100% certainty, one way or the other, then I would question them, because I think that the first thing we have to acknowledge in medicine and in science in general is what we don't know. And so, we know how it works. We know it's effective at preventing the flu most of the time. There are other chemicals and additives in it that have raised question, and people are concerned about them. As far as the kind of numbers and studies that they have done, this is something that millions and millions of people get every single year. So with reason, people should be, doing the research on it if that's something that they feel they want to avoid or get. But yeah, I don't think I can really give you an answer as far as, this is definitely 100% safe. I think that based on what I read and based on official recommendations, that the benefits outweigh the risks. And it is recommended from 6 months to whenever. For everybody. They recommend it for everybody. And there are some rare exceptions. If you have had a severe allergic reaction or an anaphylactic reaction to that, if you have an egg allergy, although I think they kind of are taking that out of the picture as well. And then if you've had a history of Guillain-Barré syndrome, then they would probably not recommend you get it. But those are very, very rare circumstances. And I've had a lot of people come, or not a lot, but several people ask me about, and kind of the same question as you're asking. So yeah, I'm not sure how to explain those certain cases where you get the shot and then you get sick and something horrible happens.
Yeah.
It's impossible to know if those two are related or if just something completely different happened and it was just pure coincidence.
So is it possible to build up your immune system? Once you've been that sick, then my immune system might be stronger?
Once you're healed and once you've recovered completely, but with the flu, sadly, you're still just as susceptible to it the next year.
So I got a flu shot every year since then, and I've never gotten it again.
Oh, there you go. Yeah, so that's good.
That was a few years ago.
Yeah. So yes, and then the last thing, and then I'll be done talking about the flu. Tamiflu or oseltamivir. That's an antiviral medication. It tends to run on the more expensive side, compared to just regular antibiotics. A lot of medications you can get for $4. This one's will probably run you about $100 if you pay cash. It's been shown to shorten the flu illness by about 12 to 24 hours. It's not a lot. It's by no means a wonder drug, but it is still recommended for people who have certain risks like lung disease, diabetes, things like that. But for the most part, I tend to discourage it unless you have a really good reason for it, just because the side effects include nausea and vomiting. And, in my opinion, I think it's best just to kind of keep things simple and just stick with the good old rest and fluids, I think, along with some time. So, has anyone heard of MRSA? MRSA. So that stands for methicillin-resistant Staphylococcus aureus. Staph is a type of bacteria. It's one that you don't want, but we all probably have. A lot of us are colonized with it, especially healthcare workers like myself. I haven't been tested for it, but I see boils all the time, and I deal with people who have MRSA, so I wouldn't be surprised if I do have it. It's not something you can really easily get rid of, if at all. If it's there, it's just there. And as long as it doesn't get to the wrong place in your body, it's fine. You don't have symptoms from it. It's just like all the other bacteria like strep that live on the surface of the skin. Now, if you develop a break in that skin, which sometimes can be just hair follicle getting a little bit infected and then turning into something like this. Otherwise it really shouldn't cause a problem. But again, if MRSA gets into certain parts of the body, it can be pretty dangerous. So you can get it from touch, or just living in the same home or under the same roof as someone, sharing a razor or something like that. And some people are carriers. Again, this is something that, because of the use of antibiotics, we are seeing this microevolution of bacteria to develop a resistance. And so because of that, we end up having to use stronger antibiotics. And, so that's the case with that. So it can cause an entire range of diseases just depending on the location of the body. And of course, again, hygiene, very important. For something like this, what we tend to do is, if it's a smaller size, we'll just cut it open and drain it and get the pus out. And that's usually enough, along with some warm compresses and keeping it clean. If it's larger, if you have a fever with it or something, then we'll usually do some antibiotics for that. And, all right, so do we know what we're looking at here?
Chest x-ray.
Okay, so this is a chest x-ray. This is the left lung, this is the right lung. Here's the heart border right here, and then you can see the rib stripes all the way down there. And so you can kind of see a difference between all this nice, healthy air in that lung, whereas this large patch right here. So that's a pretty classic appearance for a what we refer to as like a right middle lobe pneumonia. And so this is pneumonia, and this can be. I didn't do say a whole lot about it because again, it's one of those things that's like I can say very little or a whole lot about it, and so I chose to say very little about it. But it can be caused by viruses, bacteria, even fungi in some cases. Or you can actually, if you choke on something, inhale some stomach contents that are acidic. That can cause a pneumonitis, which is just an inflammation in the part of the lung that looks like pneumonia, but it may not be pneumonia, but it could turn into pneumonia. So, in a lot of cases, we'll treat for all those things. Streptococcus pneumonia is one of the most common, and it used to be just referred to as lobar pneumonia because it would usually affect an entire lobe of the lung. But it can be caused by a number, a lot of other different types of bacteria. And this can be contracted via inhalation, or if your immune system, for whatever reason, just takes a hit. And again, if you had a flu virus or something like that, and you were just down, not hydrating well, not doing very well, and after about a week, instead of getting better, you start to get worse, then you could have one of those secondary infections. And so, of course, smoking is bad for that, bad for the lungs. It will increase your risk by a factor of 4 if you're a regular smoker. And then, of course, if you're doing anything else to harm the body, such as alcohol consumption, and just simple things like staying sedentary. People who are residents of nursing homes, unfortunately, if someone is at a stroke or is wheelchair bound, I mean, how frequently do you think that person is getting out and getting fresh air and actually expanding their rib cage? Just doing something as simple as expanding their lungs. Again, when we're healthy and able to walk and breathe fresh air, it's easy to take that for granted. But some people, unfortunately, because of underlying disease, or because people are just homebound and don't get out and just don't move, then that's enough to keep the lungs from expanding and increase risk of something like that. So I'll go ahead and touch, moving on to parasitic infections. This is kind of another category of infections. So I had to touch on this one. This is one of the most interesting ones that I know of. This one and another one that has a really interesting life cycle. Taenia solium it's a tapeworm, and it's classically from undercooked pork. So I hope no one is too squeamish here, but it can grow up to 10 feet in length in the intestines. It sounds pretty bad, but people can carry these things around for a very long time, and there may be a bit of malnutrition because that's kind of stealing the nutrients from the intestines, but you may not even know it. It may not even really cause symptoms. And so there's no telling how many people are carrying these around, especially in developing countries where they don't have certain standardized cooking practices. Like if you go out and eat at a restaurant here versus somewhere else, that could be a big difference. So that actually is not the dangerous kind. The dangerous kind is contracted not from eating the pork itself, but if someone who has the tapeworm gets their own or someone else's fecal matter on their hands, just didn't wash their hands well after using the restroom, then the eggs or the larvae, if those are consumed, then that's a whole different story. That causes cysticercosis, and the most devastating form being neurocysticercosis. So that's the kind that actually goes to the brain. Not good, as you can imagine. Anything growing in the brain that isn't just brain matter is not a good thing. So it can cause headaches and seizures and eventually death if it's not treated. And they've even postulated that it could be the primary reason that epilepsy rates are double in developing countries, which is kind of an amazing and scary thought. And so here's the worm on this side. And then this is an MRI of someone's brain that looks kind of like Swiss cheese as well, but these are actually all cysts here. So this person has neurocysticercosis. I took care of a gentleman, and now this is very rare, and I have to say I've probably seen one case of it that I personally diagnosed. And it was a gentleman who was not acting right, and I believe he had a seizure. So on his brain scan, he had one large cyst that was probably about the size of a golf ball in his brain. And so he had to be transferred over to Seattle to have that taken care of. Malaria, not something that affects us here, but it's still a very interesting disease and a very devastating one at that. This is a mosquito-borne illness caused by something called Plasmodium. And this is a protozoa, so now we're touching on a different type of infection altogether. This is under the category of protozoa. So this causes fevers, chills, and flu-like symptoms. And it's all about context. So if you're living here and it's the winter, then those symptoms would be the flu. If you're living in sub-Saharan Africa in any time of year, then it's malaria. So in 2015, they estimated that 214 million people, that's getting up there to what is the population of the States, 300 million or over that? Infected.
30 or something.
Yeah, and 438,000 deaths, mostly African children. This is an incredibly devastating disease because of that reason, and it sadly does illustrate the global disparities that we face. That is just one of those sad truths that I really hope and pray that one day someone can come up with a vaccine for this, because unfortunately there is none. There is treatment, but it's just all about identifying it. So just to put that in perspective, you don't hear about malaria in the news very much, do you? Ebola was on the news for probably about 6 months or so. At times it seemed like 24 hours a day. And not to downplay that, but 11,000 deaths from Ebola from that outbreak, compared to 438 just last year alone. 438,000, I'm sorry. 35,000 for car crashes, and 151 from terrorism since 9/11. I couldn't resist. Just to, again, put things in perspective. So it is seen in the U.S., but this is primarily from people who have traveled, who have come from those countries where it's endemic, where it actually is an issue. And so these are the primary countries. It's basically south of the border in South America, Africa, India, China, and Southeast Asia there as well. The Anopheles mosquito is the type of mosquito that causes it, and I feel sorry for that volunteer.
Yay.
And so it can cause swelling of the liver and the spleen here, which they've kind of outlined in this child here. Mosquito nets, it sounds simple, but those have saved countless lives. It's the simple stuff, along with pest control and whatnot. So the symptoms take 7 to 30 days to appear after the mosquito bite. So if you travel and come back and it's been 2 weeks, you think you're in the clear. 2 weeks seems like a long time. But then you can actually develop symptoms, and that could be the malaria. Vast majority are treatable with medication. Now, it would be hard to diagnose here because that would not be the first thing on anyone's mind unless you specifically said, I just got back from Africa, because, everyone should be asking that question, but, a lot of us, including myself, don't every time. And so if it can become complicated and affect other organs. It can end up remaining dormant in the liver for life, actually, depending on the type of malaria. It can get to the brain and cause seizures and death. It can also destroy the red blood cells and cause severe anemia and death in extreme cases as well. So insecticide spray, DEET, and mosquito nets are the big preventative measures that we use currently. And busy slide, but basically what happens is the mosquito bites an infected human, it lives in the mosquito, and then the mosquito goes and bites another human, goes to the liver of the human, and then it hatches, it multiplies and hatches a lot of eggs, and gets into the bloodstream, and that's how it causes symptoms. So kind of a busy life cycle. So, okay, so that was all infectious disease. That's going to be the majority of my time, but just to give, I guess, maybe some surface type material and information on some of the other things. We'll talk about lung disease for a bit. Does anyone have questions on infectious disease just while I'm transitioning?
So is it, you said that the influenza and the malaria virus, right? Is it
Malaria is a protozoa.
protozoa?
Mm-hmm.
They have very similar symptoms. So if
Yeah,
you're
they
in
do.
America,
Mhm.
then you would call it influenza most likely. And
Right, well, and we have testing as well, because you can actually look at someone's blood under a microscope and see malaria, if the pathologist knows that's what they're looking for. And then we have pretty good accurate testing now for the flu.
one more question about that.
Mhm.
So can you be a carrier of malaria for decades, or is that something that dies off?
No, there are a total of 4 types of malaria that affect humans, and 2 of those types can become chronic and stay in the liver and then become reactivated. And people can get chronic liver disease and chronic malaria because of that. That they'll be fine, and then the malaria bug will actually hatch and reproduce and get into the bloodstream and then cause symptoms. Then they'll get put back on medications, or the body can fight that a little bit and get it under control. So yeah, some people do deal with it for life. I think most of it's curable, but it's definitely, if you're not taking any medication for it, then it's likely to stay there if you have one of the chronic forms of it.
Thank you.
You're welcome. And so for lung disease, so just basically the lungs just exchange oxygen with carbon dioxide. That's what they do. As far as disease goes, there's a restrictive pattern where they can't expand adequately, and then there's the obstructive pattern where they actually can't exhale. So the restrictive pattern, we don't see it quite as commonly, but it can still be devastating, just depending on the cause and the prognosis. But if you've heard of asbestos exposure, if you get asbestosis, then that can cause restrictive lung disease. Pulmonary fibrosis can be caused by certain medications, certain types of autoimmune disorders, and that's actually where the tissue in the lungs actually changes the architecture a little bit. And instead of being that nice pliable spongy stuff, it becomes kind of, I don't know a good thing to compare it to, but I guess it just becomes harder to expand, just for whatever reason, because of the change in the tissue. And then with obstructive, that's going to be, so asthma, that's a reversible cause. You take your inhaler and you're fine, and some people have very mild asthma, some people have it severe. And then there's COPD, emphysema being a type of that. Here's a picture of the lungs, just in case you forgot what they look like. And so, healthy lung, smoker's lung. So COPD, this is something that has an immense disease burden on the person who has it and on society because of how many people it affects. Vast majority of people do have a smoking history. There are some other causes for it as well, so it's not like you immediately it can be assumed to be a smoker or a former smoker with it. But the vast majority is. So in 2013, it affected 329 people. 29 million people, which that is about the population of the U.S., I believe, and estimated to have been responsible for almost 3 million deaths. So 20% of smokers get it, but if you smoke for life, then it's a coin toss if you get it or not. Those are pretty bad odds. And honestly, I mean, based on what I have seen, I think that it's a spectrum, and I don't think there's going to be a single person who has smoked for years who has normal or healthy lungs. I mean, that's just nearly impossible, if not just impossible. They may not carry the diagnosis. They may, for whatever reason, have not been affected as much by it, but I guarantee that there has been some effect. And so, again, of those with COPD, about 9 out of 10 people have smoked. Again, there's a minority that has not, and it's because of some kind of secondary exposure or a genetic cause. And then not so much an issue in the States, but people who do a lot of cooking over a stove, especially if it's in a tent or in a hut or something like that, it can get very smoky in there. And if you do that twice a day for years, then that's a lot of smoke exposure, and that can cause COPD as well. And so this is what some people the image they may have in mind when they start smoking. But sadly, this is the image that I have, just after seeing and taking care of hundreds and hundreds of people who sadly have a very preventable cause of this disease. And so if you look up quitting it, there are some really cool resources out there, and there was this one where it had a timeline where it actually went from, I think, like 3 minutes all the way until 20 years out, just kind of going down the list of what happens once you quit. And so just the highlights, it takes about 12 hours, but your oxygen level does normalize after you take your last puff of a cigarette. After about 72 hours, so just 3 days, the air sacs begin to relax in recovering smokers, and breathing actually does become noticeably easier. 2 weeks to 3 months out, after, again, quitting smoking, your actual lung function begins to improve, and the chronic cough improves. After 6 months, the cilia, which are the microscopic hairs in your airways that kind of keep all the debris out and do their job by preventing infection, those will regrow in the airways. And after about 10 years, your lung cancer risk is cut in half compared to if you had continued to smoke. And there's some data to say that after 20 years, your risk of lung cancer is about the same as someone who has never smoked. So you can always, use the argument that it is definitely never too late to quit. Even someone who is, middle age or even older age, you can start seeing some benefits within 2 weeks, just of feeling better. So we'll touch on a few gastrointestinal diseases as well. So peptic ulcer disease. So this is another common one, typically manifested by pain in the abdomen. Sometimes you kind of lose your appetite, you just eat a little bit, and then you just don't want to finish your meal because either it hurts or just because you just don't have the appetite. Can cause nausea, vomiting, and sometimes bleeding. Some of the biggest causes are using too many anti-inflammatories like aspirin, ibuprofen, naproxen, or Aleve, things like that. Or a bacteria called Helicobacter pylori. Those are the two big ones. You can also have increased risk if you smoke, drink, or have too much stress. I mentioned the symptoms. And then complications include bleeding, perforation, which is an actual hole wearing in the side of the stomach or the intestinal wall. That can be very dangerous. And then gastric outlet obstruction, which basically means there's some scarring that can form where the stomach empties into the intestines. And if that happens, then things can just basically stay in the stomach and not go downstream until you start vomiting it all up. And in some cases, you may need surgery for that, or a dilation from someone taking a scope down and doing it that way. And then the main treatment for that would be lifestyle modification. So, again, don't smoke, don't drink, don't eat too many foods that would be upsetting to the GI system, and if possible, modify stress. We live in a very stressed out society, I think, and so it's important to maybe take a vacation every now and then. I'm speaking to myself when necessary, and then medication as well if needed. If this is a kind of a one-time thing, then again, lifestyle modification is the most important thing. But if it becomes kind of a recurrent thing, or if the symptoms have been present for a longer time, then it's reasonable to at least start a short course of some medication that would reduce the acid level in the stomach. And that would be medications like Nexium or Pepcid or something like that. You'll see commercials and ads for those. You see them at Costco. They're available over the counter. And then here's a picture. Just like a canker sore on the inside of your mouth, it's kind of the same idea. It's just a little bit worse, and it's in a bad spot that's hard to see without a invasive procedure. So as you can see, this is a small picture of the little camera going down into the stomach, and then here it advances down into the small intestine. So this is what we call a gastric ulcer, which is an ulcer in the stomach, and then duodenal, which is the very first part of the small intestine, an ulcer there. Gallbladder disease. This is something that is incredibly common. I take care of in the ER very frequently. This is usually the classic person that comes in with gallbladder disease would be someone who has been having pain, usually about half an hour after finishing a meal, especially having a slice of pizza or something greasy. That requires more bile to digest, and so therefore the gallbladder, which stores bile, contracts. When the gallbladder contracts and there's an actual stone in there, usually made of cholesterol, if it's contracting against a fixed object, you can imagine that would be a pretty painful process. And so that hurts right under the rib cage up by the liver on the right side there. Sometimes people come in with right shoulder pain, and you think of a strain, rotator cuff problem, did you fall? No, but it seems like every time after eating dinner, my shoulder bothers me. You can actually have referred pain from the gallbladder. So what you do is just give them a good poke up onto the ribs in kind of a gentle fashion, and if they guard and have a lot of pain right there, then it's like, oh, we should probably we usually get an ultrasound to take a look at that first and check the gallbladder to see if there are stones in there. If a stone gets stuck or goes downstream and affects, so the gallbladder's right here. I don't know if you can see that very well. This is called the common bile duct right here, and if it goes downstream, if it's small enough to pass that small cystic duct and goes there, it can actually block flow of any bile whatsoever from either the liver or the gallbladder. And if it goes even further downstream and gets stuck right there, it can block the pancreas. So it can cause some pretty nasty stuff. It can cause some really bad inflammation of the liver. It can cause pancreatitis, which is inflammation of the pancreas. And it's not uncommon. I mean, I see this on a fairly regular basis. And here's another good illustration of some gallstones that are passing downstream and probably causing that person a lot of pain.
So do you have to remove those surgically, or?
Yeah, so it all kind of depends. I mean, if you got an ultrasound on every middle-aged and older person walking around, you'd probably find gallstones in, I don't know, maybe a third or 50% of people. Maybe not that high, but a lot. And if you're not having symptoms, or if it hurts every now and then, but it's not affecting your life too much, then it would be a surgery, and that can have complications. So if it's something that's tolerable and you're not having any complications from it, then I would argue that living with it would probably be less risky until it does cause problems.
But so there is no this medication that can dissolve those?
There is. I think it's. I'm actually not very familiar with that, but that's a good question. It's only for use in certain patients, and that's usually when you refer to someone to a gastroenterologist, someone with some expertise on that. But it's something that would be slow. It's not something that would just be like zapping the stone and taking care of it. It would take time, and it would have to be made of a certain type of chemical makeup in order for that to work.
And there is a laser treatment, or is it an invasive procedure?
No. It's they usually do a laparoscopic surgery, so minimally invasive surgery to take the gallbladder out. If there is a gallstone that's stuck downstream, then that's something that usually, as opposed to a surgeon, a GI doctor, a gastroenterologist, would take, and they actually have a way of taking a scope, going through the mouth, all the way down into that, and actually going up into the biliary system and retrieving a stone. It's pretty amazing.
Wow.
And that's reserved for someone who has a stone that's stuck, causing inflammation of the pancreas or the liver.
Yes. Thank you.
And that would be, and if that were to happen, then that person would also get their gallbladder out as well, because if it's already happened once, then they're at risk for it happening again. And like I said, it can be a dangerous thing and very painful. But if they're really small, then they just go into the small intestine and they just end up in the feces. And then it's a bit blurry, but so age is a risk factor. I mean, the older you get, the more time you have to have cholesterol deposits settle in there and form a stone. Females are unfortunately more at risk for it. There are genetic predispositions, pregnancy, obesity. If you're obese and then you lose weight too fast, that actually can put you at risk for gallstones because of the way the cholesterol is digested. Liver problems like cirrhosis, along with a number of other things. I'm not going to go over that. There are some protective factors. Eat a lot of vegetable protein and nuts. That's supposed to decrease the risk of developing gallstones. Vitamin C, cholesterol-reducing drugs. If you have high cholesterol and you're on something like Lipitor or something like that, that's a very commonly prescribed drug, or Crestor. That can decrease the risk of having gallstones. And then coffee has actually been shown to decrease the risk of gallstones as well. Those are just some of the, there are a few others, but those are some of the more interesting ones I saw. So hepatitis is inflammation of the liver. That's a very generic term that can be caused by a lot of different things. And I could have put this under infectious disease or autoimmune disease or GI. So there are viruses, hepatitis A, B, C, D, and E.
I think it could be under malaria too, right? The liver?
Yeah, exactly. Yeah, malaria could cause it. Alcoholic hepatitis. Fat, it's called hepatic steatosis is when too much fat gets in the liver, and that is actually becoming a more major cause of liver disease and even cirrhosis, unfortunately. Autoimmune disease and certain medications and toxins. Someone who is overdosed on Tylenol can actually cause hepatitis and liver failure. I've taken care of someone who had a liver transplant because they had overdosed on Tylenol at one point in their life. And then if you get this symptoms include fatigue, nausea, muscle and joint aches, and yellowing of the eyes or skin. So A and E, hepatitis A and hepatitis E, those are something that you would probably pick up from some lettuce that wasn't washed appropriately. It can happen in the States, but more often you can pick it up in other countries. That it can be a pretty nasty thing, but it universally resolved after a few weeks to a month. Hepatitis B, that can be a bit more serious, and in rare cases it can become chronic and lead to cirrhosis. But most of the time it's better after 3 months, and most of us are vaccinated for that as well, which is nice. And then hepatitis C, that's the one that you don't want. That's why we take a lot of precautions as healthcare workers to avoid needle stick injuries and blood exposure. We see it a lot in people who have been IV drug users either currently or in the past. And back in the day, tattoos could actually cause that. Piercings back before they had
Blood transfusions back before they
back before they checked for it. Yeah. And then severe hepatitis can cause liver failure, and I'm going to touch on cirrhosis as well. That's a pretty devastating illness, but interesting as well. And here's so the medical term for this is called scleroicterus, when the whites of the eyes turn yellow, and that's typically from a lot of times in this case it can be from liver failure or hepatitis, I should say. And then you can tell that this person's skin is quite yellow. That's referred to as jaundice. So cirrhosis of the liver actually results. That's something that is pretty much irreversible. There are different levels of severity. If it's early or mild, then you can live with that for the rest of your life and die of something else, assuming that it came from something like alcohol exposure, and that may have been a wake-up call for someone to quit drinking, and then they have some liver disease, but they're still okay, it still works, they do okay. If that person were to continue to drink, or if it's a hepatitis C infection that is chronic and continues to damage the liver, then that can result in end-stage liver disease, which is a very devastating thing. People worry a lot about HIV/AIDS, but this is hepatitis C is probably I would argue a worse bloodborne pathogen to get just if you were to be exposed by something. In all too many cases, it can lead to liver failure and death if you don't have a transplant. Signs of this. The liver is a very, very important organ. You can't live without it, obviously. It filters toxins, it stores sugar, so that we don't have to continually eat all the time. If we go into a little bit of a starvation state, it can release some extra glucose into the bloodstream and help us out that way. And it helps with metabolism and things of that sort. It helps break down ammonia. You wouldn't think of ammonia being in our bloodstream, but a little bit is there, and it's taken care of by the liver. But if the liver doesn't work, I take care of patients who have very high ammonia levels and come in extremely confused. And a lot of times the family or whoever was taking care of them just doesn't know why. But if they also have liver failure, then that's one of the first things that you think of. So it can cause confusion. It can cause kind of a change in the look of the blood vessels. Initially an enlarged liver, and then it actually shrinks down and scars. And then something that we refer to as ascites, which is fluid in the abdomen. And this is not a pregnant male here. He has ascites from liver failure. And a lot of times that will need to come in and get drained off by a procedure that either myself or someone will do in the clinic or something like that. And here's a comparison: healthy liver and cirrhotic liver. Pretty obvious differences there. So, good. 8 o'clock. So 1 Corinthians 6, 19 and 20. I'm sure a lot of people, if not everybody, are familiar with this, but it says, "Or do you not know that your body is the temple of the Holy Spirit who is in you, whom you have from God, and you are not your own? For you were bought at a price. Therefore, glorify God in your body and in your spirit, which are God's." I feel like that was a good note to end on, something to really ponder, the fact that we are not our own and that we were bought with a price. I think that's very, very important to just think about and appreciate, and just this gift of a healthy human body. And does anyone have any questions about any of that? Hopefully it wasn't too dry.
No.
Okay, wonderful. Well, that's it. Thank you all for listening.
Thank you.
Thank you, Dr.